Late Night Health continues. I'm Mark Alyn. Our guest, Dr. Paul D. Corona, MD, the author of Healing the Mind and Body. We're talking about sleep, and I just want to mention that we're going to put up some photos of me on Late Night Health with some celebrities. I met with Jean Rowland, who is an old friend and was a production assistant of mine 25 years ago. And she found some pictures of me with a number of people. We'll put them up in the next couple of weeks. They're kind of fun, and I look like I'm 14. At least I do to me. And I had a flat stomach, too. The importance of sleep. A lot of people say, I'll sleep when I'm dead. A lot of people will say, I've got a lot to do. I cannot sleep 8 hours a day. It's just, I can't do it. How do you, as a physician, respond to a patient who says that?
Well, I always assess what else is going on in their life and you know how they're functioning. I mean, some people literally can get by with 4 or 5 hours and do totally fine. I mean, the statistics, like I said, 7 to 8 hours is the average ideal, but some people do get by with less. It really depends on how they do with the rest of their life. How's their focus and concentration? How are they doing at work? How's their anger? Are they, you know, how's their mood? So I really do try to do a full assessment of patients when I'm evaluating that.
And what about catching up on sleep? I'm going to catch up on my sleep. In other words, I'll do 4 hours every night this week, but Saturday I'll get 6 or 7. Does that work?
It does work. I mean, some people will, you know, like I said, if they get 4 or 5 hours during the work week and then they sleep in on the weekends, I'm not able to do that. I've tried to and I can't. But some people do sleep like 10, 11 hours, 12 hours on the weekend to catch up. And
I don't understand how anybody can do that unless they're occupied in bed with somebody else. It just doesn't make sense to me. I guess I'm not a great sleeper. I'm getting better at it. Last week, I was not sleeping in my own bed. I was helping a family member and staying over at somebody else's home. And I had a couple of nights of great dreams, something I don't normally do. I did not have the best night's sleep I've ever had, however. But I did remember my dreams. And now I have to figure out why I was dreaming of a woman I haven't seen in 20 years. But who knows? If I don't have enough sleep, it can affect my work, it can affect my mood, it can affect stress, anxiety.
More likely to get into a car accident because I'm more easily distracted. Yeah, so there's some danger associated with lack of sleep, not concentrating on things like that, things like driving. But yeah, it's typically most patients can't go that long with poor quality sleep. People go through stretches of it, but you know it's definitely not good for you to not get quality sleep.
And what about exercising to get better sleep?
Right. So when I assess my patients, when I assess their mood, I also look at their exercise program. Regular exercise, not late at night when you're going to go to sleep, but earlier in the day, is very helpful for lowering stress and then helping sleep. A proper diet, not eating too late at night, which can lead to problems with heartburn and problems with sleep. Drinking, some people will drink to sleep, but the problem is that with using alcohol for sleep, it's not quality sleep, and it wears off quickly, and then people wake up in the middle of the night. You and I have had a beer together or two, and
I don't overdrink, but every now and then I'll have a drink to relax. Is that okay?
In my opinion, yes. Social drinking is fine, but when people are drinking in order to sleep, normally the drinking becomes a bit too much in those cases.
Gotcha. Healing the Mind and Body, it's a trilogy. You can get some information by going to drpaulcoronamd.com, drpaulcoronamd.com, or you can go to latenighthealth.com and just click on Paul's pretty face. Dr. Paul, we will talk to you next week, and we still haven't brought Chuck Smith on, who wrote your foreword. We have to do that in the next 2 weeks. Okay?
Yep.
All right.
He read my foreword, and he was my editor for all 3 books, too.
Oh, got it. Well, we'll have to bring Dr. Chuck on in the next few weeks. He's not a doctor. He's a pastor. It's a difference. Anyway, thanks a lot. We appreciate it. Dr. Paul will return next week. I'm Mark Alyn. If you don't get hour 2 of Late Night Health, you can always get it at latenighthealth.com, latenighthealth.com. We'll see you around the corner in just a couple of moments. Don't go away. More coming up here on Late Night Health.